Great. We'll start over. We have with us today our Santa Cruz County Health Officer, Dr. Newel, who spearheaded and helped our county navigate the challenges of COVID since the onset of the pandemic. And today she is going to give us an update as to the current status of, I believe, the COVID rates and other viruses in our area, and probably insight into the current health challenges in the county. And then if hopefully we'll have time after she speaks to have her answer some questions, and I may ask her about her activities in Burning Man. So without further ado, Dr. Gail Newel.
Well, thanks for having me tonight. I haven't been doing a lot of speaking in the last few months. I've been having my deputies do more and some of my other leadership. So it's a real privilege to be able to join you. And I have a lot of slides, but I'm going to ask your leadership to send those out, those of you who have it, and you can distribute those anywhere you'd like. It's taxpayer money that produces these, so they belong to you all. And so there's a lot of very dense information in the slides at the end having to do with all the new changes with the end of the public health emergency. Those will be attached, but I'm not going to cover very much of that today. So I'm going to give you an update of where we are with COVID-19 and other viruses in our county. So let's get to it, and I'm going to whirlwind through these slides. So let's go next. And I always like to start out by putting our county, our beloved county, within a greater perspective. So let's look at some global, national, and state data to start. So next. So this is what's happening right now. This is as of today on the World Health Organization website. And it shows cases since the beginning of the pandemic in 2020. Worldwide by region defined by the World Health Organization. And you can see that right now the Western Pacific is getting hit particularly hard. And we in the Americas are getting kind of a break right now. You know, when this all started, I said, well, the Spanish flu, the flu of 1918 lasted 3 years. So that's a good precedent. Maybe ours will do the same. And indeed, we're kind of transitioning from pandemic to endemic right at the 3-year mark. History is helpful. So next slide. So this is on the website today again, but it's from last week. Globally, 761 million confirmed cases, but there may be between 10 and 20 confirmed cases or cases of COVID for each one of those confirmed cases. So I'm certain that we're in the billions of cases by this time in our almost 8 billion worldwide population. And statistics show, or testing shows, that probably over 90% of the world's population has some immunity to COVID-19 at this point, either through disease or vaccination. We've had close to 7 million deaths. That's a lot. Each one of those is important and should be mourned. But when we look at the Spanish flu, the flu of 1918, about 1% of the world's population died during that flu, 25 million deaths of a much smaller world population, and we are below 0.1% of deaths. So we're doing a little bit better, a lot better this time around than we did 100 years ago. And over 13 billion doses of vaccine worldwide. So pretty impressive. Next slide. So how does the United States look? We're all looking pretty good right now. So I hope you're somewhat familiar with the low, medium, and high community transmission rates that the CDC is scoring us by now. Every week, we get placed in one of these categories. I'll say a little bit more about that, but the United States right now is pretty darn green, which is good. Next slide. So here's this CDC community level of transmission. And this is what we're largely going by now for recommendations about how we should be doing our individual behaviors. So we're in the green for go. And basically, if you're a normal, functioning, immune competent kind of person in our country, the recommendations now are that you stay up to date with your vaccines. And if you have symptoms, that you get tested for COVID. And that's the recommendations right now. So if we would go into medium transmission, then those of us who are at higher risk would be recommended to wear a mask at all times when we leave our homes. And then in high transmission, the entire population would be recommended for masking. Next slide. So in the state, we're also doing well, and this is updated every week on the state dashboard. All of these slides also have links where you can follow this data if you're a data geek, and watch our vaccine rates, our case rates, our deaths, and our tests. But you must remember now that the cases, the testing that we're doing, this only captures the PCR tests, not the at-home antigen tests or the quickie tests in your doctor's office. So only a small percentage of positive tests is reported into public health and onto the state, the nation, and World Health Organization. So case rates are no longer very helpful. Next slide. So let's look at what's happening locally. Next slide. So here we are in the green, and fewer than 200 cases. So we're at 60 new cases per 100,000 people in the past 7 days. Most likely it's 6 to 7 times that. In reality, if we were to get all cases reported and adequately tested, but we're not measuring on that scale anymore. So now we're looking more at hospitalizations. So if you look in the medium column, the yellow column on the bottom 2 numbers, we watch these very closely. These are our hospital COVID admissions, which are sitting now at 6 per 100,000 population per 7 days, and our inpatient beds occupied by COVID patients. So we've been running around 15 COVID patients in our hospitals at any given time, day after day for months now. Next slide. You're probably all more used to looking at this data dashboard. This is at santacruzhealth.org. And if you notice in the upper right-hand side, there's a green dumbbell shaped kind of figure. And if you're looking at this live, if we were running this live, you can slide that and look at even as small a time period as a week, and up to the entire pandemic, which is what's showing on this screen. And oh, it's a widget. Thanks, Glenn. It's called a widget. And that you can look at all of this information through just the widget, this tiny point of view, or the entire 3 years of the pandemic. Our epidemiology team is updating this every week. And so the really exciting thing is that death number, the 276 deaths in our county to date, in our 3 years of pandemic, has not changed in several months. We have not had a COVID-related death for many months now, or several months. So we're all very pleased about that, and feel good about how we're protecting our most vulnerable residents from hospitalization and death. Next slide. So this is an important graph that has been developed by our epidemiology team along with the researchers at UC Santa Cruz. And they've really been cutting edge in epidemiology in the state of California and the nation in developing their modeling. And this one is particularly helpful. It's easy to look at because if it's green, it's good, and yellow, we're cautionary. Once we get to that dark black line at 1.0, that means our community transmission is on the iffy side, and we may be headed into a little more COVID than we've been. So that's where we are right now. And that's updated every week. That's called the reproductive number, or the RT. Next slide. These are all on our data dashboard at santacruzcounty.org. And this is our hospitalizations with future projections, not much increase there. So our immunity is kicking in and helping us protect ourselves and our population from the current strains of the virus. Next slide. And so things have been pretty steady. You can see the cases keep coming in, but nothing concerning at this point. And next slide. This is a little bit confusing, or perhaps very confusing. This is year over year. And if you look at the different shapes on the graph, you can see number of cases. And currently in 2023, it's the brightest area, the highlighted area on the bottom left in circles and in larger circles. And it shows that we have had a very flat and continuing case rate in 2023 compared to previous years. Next slide. And there was some interest in knowing about how gender, race, ethnicity, and age play into case rates, and also geography. So I'm going to spend a couple of slides looking at that with you. This is the active cases, so the 300 or so current cases that we know of, broken down by gender, by age, and by race ethnicity. And all the way through the pandemic, we've seen our 25 to 45-year-olds as the greatest impact. But now we're starting to see some of our younger kids, the 10 to 14-year-olds. So they're a little bit less vaccinated, way less boosted. And so that may be showing up there. But our 25 to 45-year-olds, that's our workforce that really have no choice but to be out and about in the community with lots of exposure to various community members. And then at the beginning of the pandemic, the first year and a half until vaccinations came around, the first year, our Hispanic populations or Latinx were much harder hit. More recently, Caucasian have been harder hit. It's a little hard to see with these small numbers, but you can look at known cases, the different tabs you can highlight at the top. If you were looking actively at this, known cases, known deaths, and death demographics. And so yes, Glenn, there is a comparison. The little black bar shows where we would expect the blue bar to be if it were proportionate to the county population, that portion of the county. So what we're looking for, and I should have said this, is where the blue bar goes past the black bar. So females, for example, are experiencing COVID more than males, at least in cases that have been tested that we know of. And the race ethnicity is not too helpful on this one because there's so many folks who have represented themselves as another race, ethnicity, or multiple race, or declined to answer, or unknown. So, but if you look at the age, well, there's several ages that exceed population, but you can see them now past the black bar. Next slide. So this gives us a little idea of where things are geographically and broken down by communities and what percentage of active cases, but you can also look at known cases to date. And at the beginning, as I mentioned, South County, our Latinx population was much harder hit than North County. But now, since vaccinations and South County got vaccinated really well, North County has consistently exceeded their expected proportion of cases. Mid-County somewhat, not quite as much, and South County has been performing better. So if you look at zip codes, you'll see the same kind of findings. And next slide. So the gold right now on our data is in wastewater. So let's look at that. Next slide. I was going to say let's dive into that, but that's a little bit gross. So what the United States early researchers found is when they looked for COVID-19 in the wastewater of our sewer systems, that they could pretty accurately detect what was happening in communities. And so they followed this over the last 3 years and had excellent correlation with disease rates, with case rates. And so now that we're not seeing a really good, accurate picture on our case rates, we're relying more and more on wastewater around the country and here locally as well. So we're very lucky to have wastewater evaluation here in Santa Cruz County in 3 different areas. Much of the nation does not have wastewater, and even a lot of the state of California does not have wastewater evaluations. So we're very happy that we have that and in our county. And so next slide. And they test it with the same kind of test that we swab ourselves with. And so you can see that different regions, we can follow the wastewater in the different regions of the United States. So you can see that right now the Northeast has higher rates than anywhere else and has for the last several months. But the upper mid or the Midwest has surpassed the Northeast right now, and California, the West rather, has done pretty well the last few months. But even more exciting is that they can actually sequence the DNA and the RNA and look at the variants and watch them morph over time. So we're always carefully watching these viral mutations to see if there are worrisome strains, and not just in the US, but also worldwide. So we can follow what's happening with variants here. And next data, yeah. So this is just an image of what's happening in one community in San Diego, and you can see that they're following, even in their own community, all of the various variants that are happening. Right now, we're mostly seeing XBB.1.5.X, but that is fading away in the presence of XBB.1.9. And so we're watching that closely to see if that's going to overtake and if it's making any more severe disease. So far in other parts of the world, it is not. Next slide. So these are the lineages that we're watching in California right now. I mentioned the 1.5. We're watching the 1.9 that's been in Europe for quite a while now and has pretty much squashed out the 1.5. It does not look like it creates more severe disease. We're looking even closer now at 1.16 in other parts of the world. In India, where we're seeing more of the 1.16, and these are all Omicron mutations, by the way. But in India, we're also seeing increasing case counts. So there's a little concern that that 1.16 might be worse. But you can see that our epidemiologists are following very detailed lineages. Next slide. So here's what we're seeing locally. The red is Santa Cruz County, which is a collection area in Mid-County. So that's most representative of Mid-County. Green is in Santa Cruz, the city of Santa Cruz. And blue is the city of Watsonville, which just came online in November with their wastewater testing. And as we're seeing lower case counts in Watsonville and fewer hospitalized folks in Watsonville, that makes sense with our lower wastewater rates in Watsonville as well. I did want to mention that our wastewater is also being watched for flu and RSV and norovirus and monkeypox. So we can see if any of those things flare in our county. Next slide. So our epidemiology team, along with the UC Santa Cruz folks, also have made this into projections for COVID in our community based on wastewater, and that's what this is. Next slide. Oh, let me say one more thing, go back on that one. Can you see the little yellow line there? That's where our epidemiology team says we're at risk to enter into the yellow zone or the moderate risk. So we're still below that, but getting a little bit closer to that. Next slide. All right, let's see how we've done on our vaccination rates in Santa Cruz County. Next slide. So these are from the end of 2022 because we stopped creating our weekly modeling because our vaccination rates now are so slow with very little progress happening, especially in the primary series, which this graph is watching. But you can see that we were shooting for an 80% vaccinated of our total county population with our primary series, and we did exceed that. So we're very excited about that, or we exceeded at least one dose. And that's a big goal. Not many counties in the state or nation have gotten over 80%. Next slide. And here you can see, again, if you go live at santacruzhealth.org, you can play around with these buttons and look at the partially and fully vaccinated. But this is all folks who've gotten at least one dose of vaccine. And the light blue bar is the percent of population, so all eligible individuals. And then the dark blue bar is the folks in that age bracket who've gotten vaccines. And so you can see also by race, ethnicity, by gender, and by age. So the folks we're most worried about that we really want to see get vaccinated are 50 and up. And we've done very, very well there with 90+% of those populations getting vaccinated. Gender-wise, we're pretty close. And race and ethnicity, we've done pretty well across the board with equity there. Next slide. There's a question about on that last one, did more people get vaccines and were eligible? I think that counted people who got, I was going to say a third primary series if they were immune compromised. So more than the expected vaccine doses for that group. Perhaps. It's a good question. Next slide. So how we do compared to the state. So Santa Cruz County is in the upper left corner and then statewide is in the lower right. So it compares the populations of those 12 and up, although at this point, 6 months and up are eligible for vaccination. But they say that 77.2% of our population got the full primary series. And this is as of today's data, and compared to the state of 72.8%. And then we're above on the primary series plus the booster and the latest booster, the bivalent booster as well. So we're significantly higher in all measures compared to the state. Next slide. And we're really especially pleased about this. If you look at the state, this is based on Healthy Places Index, which utilizes census tracts throughout the state to look at vaccine equity. And so blue is less healthy and green is more healthy. And what we would expect to see, because more healthy generally are more affluent and more likely to have access to vaccine. And so as you see in the state, the healthier the quartile, as you go up from quartile 1 to quartile 4, then you see higher vaccination rates. But what we want to see is higher vaccination rates in the more vulnerable communities, so the less healthy communities. So dark blue is our least healthy quartile, and we have an over 95% vaccination rate in that quartile. In the light blue, the next quartile, we see we have an 83.6%, and then a little bit lower in each of the quartile 3 and quartile 4. So that's exactly what we want to see. And again, that's we're one of the only counties in the state that have achieved this. And I want to give all the credit to our South County partners. We really turned our vaccination efforts over to our South County community-based organizations and let them run with it, including Salud para la Gente. And they ran their own vaccination campaign and did a fantastic job. Next slide. So I was asked to say just a few words about respiratory syncytial virus and influenza, flu. So let's look at those. We had a rough year with both of those viruses this year, although both now are very low, back to baseline. But our season was really rough. And we're not exactly sure, nobody is exactly sure why that is, but we know that masking and less social interaction probably had something to do with low rates in the 2 previous years, but that meant that we were more susceptible this year, especially our younger children who had never, therefore, been exposed to RSV and flu, and they're very sensitive to both of those. And also with COVID around, our typical seasonal presentation of all viruses has changed a little bit. Flu and RSV both had very early starts to their seasons this last year, and we didn't see any influenza B at all this year, or essentially none. We usually see 2 waves of flu, A followed by B, and we haven't seen any B. And so, but it's not too late. The flu season can extend into the summer. So those of you who haven't gotten your flu vaccine and are willing, I would still recommend that you do so. And during our RSV surge in particular, there was a real bed shortage in our hospitals throughout the state, especially our pediatric beds. And we had some of our most vulnerable kids in beds being taken care of by staff and in hospitals who don't have experience with children, and we don't want to see that. So that's the kind of thing that we watch for and are trying to control in future seasons. Next slide. So just a reminder that for flu, it was high, as I mentioned, that the best measures are hand washing, staying home when you're sick, masking, getting vaccinated. And it's not too late to get your flu vaccine. And there's some websites there that you can go to, or your local healthcare provider, or the pharmacies around here are very good and pretty excited to give flu vaccines still. Next slide. And then RSV, or respiratory syncytial virus, usually seasonal throughout the world. Mostly we're worried about our kids under 5, because once you're over 5, we generally have developed immunity. But adults 65 and over and folks with chronic lung disease also can get hit pretty hard. Next slide. All right, just a few words about the end of the public health emergency. Next slide. So why now? Why are we calling it quits on our huge efforts to respond to this pandemic? Well, we've mostly moved from a pandemic to what we call endemic disease. COVID will be with us for the foreseeable future, certainly through our lifetimes. But we know better how to treat it now. We know how to protect ourselves and our communities. We have vaccines and treatment and masking, testing, ventilation, and air filtration. And our hospitalizations and death rates are lower than they've been in previous years by a long shot. And as I mentioned, over 90% of Americans and folks worldwide have some level of immunity, either from disease or vaccination. So in public health, we'll be focusing on our most vulnerable. Those are our elderly and ill, especially those in the skilled nursing facilities and our long-term care facilities, our uninsured and our unhoused. Next slide. So here's the timeline. The California public health emergency ended on February 28th. And on March 18th, the state aligned with the CDC to change their isolation and quarantine. So now when you get a COVID positive test or you have COVID, you only need to isolate for 5 days. You don't need to test unless you're a specific kind of worker, like a healthcare worker. And you can come out of isolation after 5 days if you've had no fever for 24 hours and your symptoms are improving. You're still asked to wear a mask for an additional 5 days, but you don't need to isolate. And quarantine is no longer either. So even if you've had a high risk exposure, you're asked to mask, but not to stay home or keep yourself away from others. Just keep wearing your mask for 10 days post-exposure. On April 1st, Medi-Cal continuous coverage ends. That's a big deal for the 1/3 of Californians who are covered by Medi-Cal. Actually, it's about half of Californians are covered by Medi-Cal, a third in the county of Santa Cruz. Yesterday, the updated guidance on masking and vaccination went into effect. So there are no longer any masking requirements at all, except for very few healthcare workers who work directly with the virus. And the masking is by recommendation only now. And on May 11th, the federal public health emergency will end. And that will mean that a lot of our funding streams for our special programs around COVID will end as well. Next slide. Locally, we had both a local health emergency and a local emergency. And the local emergency will terminate on April 29th unless the Board of Supervisors renews it, which is very unlikely. Our local health emergency already terminated last week on March 30th, 30 days after the end of the state public health emergency. Next slide. So I already talked about this, but the isolation and quarantine guidance, the new guidance went into effect March 13th and the masking on April 3rd. Next slide. So for most of us, we're not going to have a big impact to these changes. Your COVID testing, vaccines, and treatment are still going to be covered as long as you have some sort of healthcare insurance, health insurance. It's required to be covered without copay. But some of our special programs that have relied on federal funding will be expiring. There are large stockpiles of testing supplies, vaccines, and COVID treatments like Paxlovid. Those are expected to last through the summer, but will run out in the fall. And that's when the commercial insurers are expected to pick up those costs and run with them, and we'll see how that goes. Next slide. And just a few resources for you and your friends and community members. Next slide. If you're looking for a vaccine, you can go to your local healthcare provider or to our website, which we keep up to date with current vaccine opportunities. Same for testing. Again, at our website, use that link. You can still get free at-home test kits through the federal government by calling that number or going to that website. And for treatment, we're encouraged to call your medical home, your own healthcare provider. But if you're not getting a response within 24 hours or you don't have a medical home, then you can go online to Sesame Care or call. They have multiple languages and they will get you Paxlovid overnight shipped to your home. Next slide. And I want to emphasize that people over 50 with COVID or with any kind of medical conditions, putting them at risk, should definitely consider Paxlovid. If they're very ill, they need something else, and that kind of treatment would be coordinated with their primary care provider or through their medical home. But most of us should be taking Paxlovid within 24 hours, definitely within 5 days of getting a positive test. And there's more information about that here. And next slide. Information to share with folks on how to get treatment for free, even if you don't have a medical home. Next slide. And some county-specific resources, including our call center, which is still open and operating 5 days a week during hours, or you can use 211 24/7. If text 211, text a question to 211, and our 211 system can help with questions as well. Also, you can email vaccine questions. Community Bridges has vaccination help, and they do also in Indigenous languages. And you can find free masks, free tests, and follow us on social media. And next slide. This is the last slide. I just want to remind people that we're still working on our Save Lives effort. And a reminder that each of those letters in Save Lives stands for something that our public health department is working hard at. And now we're focusing on elevating readiness, getting ready for the next surge, getting ready for the next virus, always trying to be prepared. And next slide, I think, is just a questions slide, and I'm happy to answer questions or entertain comments.
There were a couple of questions in chat along the way.
Yes, some of those may have been answered, but let's use the hands if anybody has questions. Either wave at the camera. There we go. Bob's got a question, and then, or you can also use the reaction button for anybody else who wants to speak. And then if maybe we can go down to the questions in the chat. But Bob, go ahead.
Yeah, thank you. And Dr. Newel, thanks very much for a very informative presentation. You know, now that we're coming into what appears to be at least the tail end of this, let's say COVID-29 happens, you know, God forbid, in, a few years. What lessons would you take away from our response to COVID-19 that you would perhaps do differently or do the same? I'm curious what might change if we had another one.
I think you mean when we have another one, not if we have another one.
It's just, whether it's 100 years or 10, it's kind of not sure. Yeah.
They say that there's 3 more coronaviruses waiting on the coast of Southeast Asia to be exported around the world. So I expect that we'll see more of this in our future as we are a global community now. I think I would feel a lot more confidence in the vaccination process, because even though people are worried that these are new vaccines, they're actually not new vaccines. These vaccines have been in the works for over 10 years, and they can be very quickly customized for whatever viral strain might arise. And I think we can feel more confident than we felt about it in the past. Although I think we also need to have some skepticism about them. For example, the bivalent booster now has shown really to be very effective in people over 50 and not effective at all in people under 50. So it really depends on your risk factors, and we're going to learn more about who needs vaccination and when and how. I think if we have more coronaviruses in the future of that family, we know a lot more about the coronavirus now, and I don't think we'd have to shelter in place or to do the kind of social distancing that we did, because we would know better how to respond and how to treat. But if we have a completely new virus again, that may be something that we consider again.
Great, thank you.
Go ahead, Laura.
Sure. I was going to follow up on the question that I asked in the chat, which is related to, you mentioned that the north part of the county, which is again what we're focused on for our club here, is kind of in the worst end of things. And I'm guessing that's more from hospital data or maybe case rate, but you said you don't really look at case rate that much because there's no sewer like in that area, except because I didn't see Scotts Valley listed either. Is that accurate, Gail?
Right. So wastewater, the 3 wastewaters are from City of Santa Cruz, wastewater collection site mid-county, which is in county sewer system, and then in Watsonville. Yeah. And a lot of the San Lorenzo Valley is on septic. A lot of the county is on septic, which makes it impossible to assess the wastewater at a community level. Wastewater has some exciting opportunities, though, for like we could use specifically wastewater at the jail and look for jail outbreaks before we would see them through testing or capturing it other ways, or in our various school districts. So that's a consideration. But yeah, we're looking more at who's hospitalized, who's having positive testing, and those kind of factors. But it is limited when we're comparing small populations.
Yeah. And so the other question I had was actually related to the World Health Organization change of recommendations for at least across the world for children's vaccines. If you could speak to that a little bit.
Questioning whether children need vaccines and that data.
Yeah, my understanding of their recommendations that just came out a week ago, so I'm not sure how familiar you are with them, but that is not necessarily to really prioritize boosting them further and further, possibly because of what you just said, that the Omicron wasn't found to be very helpful under 50 years old, so kids are way under that. But maybe there's other reasons that I don't know because I'm not steeped in it as much as you are.
Yeah, our recommendations that we act on locally are from the ACIP, so the National Immunization Group that evaluates vaccines prior to the FDA. And so they do listen to the World Health Organization, but may not change their recommendations based on WHO standards. There's different interests at play, of course, including economic, financial interests, and those are always worth reading about and listening to. But certainly the data, the most recent data on the current variants and the latest bivalent booster shows no evidence to support boosting our children.
Thank you.
Yeah. I'd have a really tough time if I had young kids with the boosters in particular. Probably not the primary series, but the boosters, I think I would have a hard time making a decision about that.
Okay, I see the Kerners have their hand up as well, but there's a question in chat that we want to address as well. This was asked earlier. I'll summarize. I put it in there directly to you, Dr. Newell, but at the same time, it's speaking to whether, I think the question is, are we living in a bit of a fool's paradise by relying on some of the testing data? Is it, you've mentioned other indicators such as wastewater and hospitalization. Is that enough to think that we're sort of out of the woods on this? Are those good indicators, or should we be thinking that it's still more of a danger than the data is showing?
I think at this point it has to come down to individual decisions and individual risk taking. Everything we do has some risk to it, whether it's getting in our car and deciding to wear a seatbelt or not, or getting in a car at all or not, or traveling, not traveling, going to the movies, eating out. And there's none of those things are zero risk for COVID. And so you have to decide for yourself and your own medical health situation and who you live with about what kind of risk you're willing to take. So I think if there was ever a good time, though, to start going out to eat, or if you haven't done that yet, or going to the movies or traveling, now's a good time. There's no indication that we're going to have a big surge anytime soon. And I think get yourself a good, well-fitting mask. Your N95, or I really like the KF94. They're much more comfortable and work just as well. And find something that works for you and wear it when you feel more comfortable wearing it. I'm 65. I'm on a high-risk medication that suppresses my immune system. So I tend to wear my masks a lot, a good mask, but not everywhere. And I go out to dinner. I was out last night in Santa Cruz, and I go to the movies and take my mask off to eat popcorn, although I'm sitting away from other people whenever I can. So, it's really a personal decision about risk. But even if you get it, the chances of you needing to be hospitalized, especially if you're willing to take Paxlovid, are so small, and of dying are also very small.
Great. I guess I'll go back. In the beginning, when we had testing, in individual testing and all of that was getting reported, we were getting obviously a lot of data from that. Do you feel that the data that we're getting just based on hospitalization rates and wastewater is equivalent to that, or is it just the best that we have?
Well, case rates from testing when everybody was getting PCR and a lot more people were getting tested, and testing was required more. We got more information out of that data because we could look at age and demographics overall, race, ethnicity, and where folks lived and who they lived with, gender, quartile, but we can't get that anymore. But wastewater's in some ways is even better because it takes the human error out of it. Everybody poops. They can't hide their RNA virus in their poop. And so from a community level, I think wastewater is probably even more accurate, just we don't get the demographics.
Yeah, interesting. Okay, great. Linda or Mark?
Yeah, my question is very similar to the question that was in the chat. So, Dr. Newell, you've pretty much answered it, but it was about large social gatherings and how, your data was very reassuring. I appreciate, thank you very much for your presentation. I thought it was very, very informative. And I feel a little better about going out into the world. But your feelings about going to attending some kind of large social event?
I'm starting to do that more and more. So, but I do wear a mask if I'm not actively eating or drinking. But again, I'm immunocompromised right now. So, if I was completely healthy, immunocompetent, if I was younger, I would go anywhere without a mask. But I'm going, but I know it's a risk.
And one other question, related to singing. I sing in a chorale and I dropped out of it because of COVID. But do you feel now that there's less risk for, activities like singing where you're kind of spewing the virus out if you are infected?
Yeah, singing is one of the highest risk activities, and that makes me very sad because I love to sing and I love to listen to people sing, especially groups of singers. But it is because you can't sing without spraying droplets. And so, choirs that at least rehearse sitting apart or with masks on are safer. But I think for the most part, choirs have given up on that and are back to normal in terms of their singing. Hopefully people are more careful about staying home if they feel sick at all. But that it is a risk. You just have to decide for yourself.
Thank you.
Great. Anybody else?
You're not singing. Thank you.
Well, thank you so much for being here. And that's all very good, great information, very helpful. And I won't press you to tell us what you were doing in Burning Man, but I'll be very curious to know if you plan on going back.
Oh no, we want to hear what she's doing in Burning Man. Are you kidding?
But to answer
That's
the
the
previous
best part of the presentation.
But to answer the previous questions, Burning Man is a large gathering of people, right? In a fairly constrained area, right?
Well,
I hear the playa was
not
dusty
that
this
Fair.
year.
it's not a very constrained area unless you're in the dance halls and
Yeah.
thing. There are some crowded areas. I went to Burning Man last year. I'm going to go again this year. I have tickets, my wife and I. It's mostly outdoors, and we mostly don't go into crowded areas. We do a lot of biking out into the deep playa, and so try to be careful. Yeah.
Good. Well,
I will say that, I signed on early and was listening to some of the chat during the social half hour. And, I don't want to be completely dismissive of alternative treatments and therapies because there's so much we don't know about our bodies and how they work and what works for people. And I think folks who want to should feel confident in working with alternative healers and with alternative therapies until they know they don't work, or if they're dangerous. Of course, we don't want that. And I still would encourage them to, even if they're doing alternative therapies and treatments, to still consider vaccination and do all the usual individual behaviors that we know protect ourselves and our families and our communities.
thank you. Thank you for addressing that. For the people who missed out on some of that fun, I did not particularly want to engage with a proposal that sounded very unscientific, and that person chose to leave at the beginning of the meeting. So that was fine. But I would second that the peer review in the scientific process is a really important part of that. And there are lots of bad ideas, and that's why we have the scientific method, so you can check whether things work or not. If drinking, bicarbonate soda with water was going to cure our cancer, we would all have figured that out and be doing it by now. So there are reasons we don't do that, and If you want to drink soda water, that's great. It probably won't hurt you, but also do your chemo. Okay.
But, you know, we do live, I mean, this is a democratic country. You're all working hard for that in this group. And I think it's important that we have a space to share what we're thinking and feeling. And so I want to appreciate and value that as well. And that's one of the great things about living in Santa Cruz. Even with the protesters and the death threats at my home, I still really value freedom of speech and freedom of expression. And so it's why we live somewhere like Santa Cruz. And so I'm not going to dismiss anybody's opinions or words for what they feel the need to say. So I just wanted to say that.
You know, Ray, someone
good.
tried to sell me homeopathy, and I offered to pay him with water that had been in the vicinity of money, and somehow he wasn't willing to accept that.
That's a great one.
Oh, Glenn.
Very good. Okay, well,
Thank you all for your good work in the community and keeping democracy alive.
Thank you for being our guest and being so well informed. Okay.
And for all the work that you did to help keep us safe as well, all the
Right.
county.
And yes, I do want to say that this community deserves so much credit. They hold San Francisco up as having the lowest COVID death rate in the nation, but ours is even lower. So we did really, really well. So I want you to know that.
Great. Okay, well, we'll let you get going.